Hi, thanks for watching. This is a quick video to show the interaction between Nuance Dragon Physician Dictation and HST eChart. As a physician, when I log into HST eChart, I will see just my patients on the schedule. When I go ahead and click on one of my patients here, it's going to take me right to that physician workflow. These are the only areas that I need to be concerned with as the physician. Everything I need to see will be right here. The majority of this was done previously, reviewing documentation, H&P attestation, physician orders. The only area currently that is incomplete on this chart for me, and that is the op reports. When I come into the op report section, a majority of this is already done for me as well, based on how that patient was charted. So we have, of course, the patient up here at the top, the pre and post-op diagnosis, the estimated blood loss, the scheduled and performed procedure, what the anesthesia type was, who the anesthesia provider was, any implants that might have been included on that case, and any specimens that were taken as well. At that point, I can scroll right down here to my op report itself. In here, HST can already have a template in here for you based on that case that will default in, or you can simply choose your template. Or one of the great features with Dragon Dictation is you're just able to go ahead and start Dragon Dictation and say something along the lines of insert need template. And it will insert that template for you right into here. You will see it'll take you to the first area of your template where you can go ahead and put in your time, maybe 45 minutes. I could say that as well, it would do it. And then I can just say next field. It'll take me to the predefined areas in that template that you enter information in. For example, next field. Next field. You can see as I'm doing that is highlighting the areas that I have preset up as the places where I make changes to the template for this individual case. Even if something hasn't been preset up and you still want to navigate to it using the voice dictation, you can do that. Maybe I want to come in here and find a certain word in the case. So I can do that by simply saying, select visualization. It'll take me to that word. I can maybe make it all caps if I need to. It'll change that for me and put me right there in the template where I need to be. You can also use commands such as new paragraph, new paragraph. And that will simply add spaces or paragraphs into the dictation as well. Of course, you can always just talk and have it type what you say. Type what I'm saying over and over and over again. Oops, I made a mistake. Undo that. Undo that. Undo that. And take me back to where I was. So once you are familiar with the commands for Dragon Dictation, it makes it easy to do that. There are a whole slew of commands in the Dragon software. Here's a quick list of the majority of the ones that are used commonly for punctuation, for inserting words, for navigating to certain words, to inserting lines or paragraphs. Very easy to do, very simple to learn. And once you do learn that, it's easy to move around in there. You can also, just like my template, create certain auto texts in here. So maybe there was a certain little blurb about the meniscus that I wanted to put in there and maybe edit. I can easily do that by saying something along the lines of insert meniscus. It'll put that in and take me right to the place where I may need to edit something for this specific case and have that information in there. All those commands, of course, are customizable, whatever you want to say them as. You can also create shortcuts. So if I were to say something like ACL, it would spell out the anterior cruciate ligament for me if I needed to do that as well. So very easy to use. Once I'm complete, I can still fully edit this just as a full text editor with my keyboard if I want to as well. But it makes it very simple to have that information in here. And then I can just go ahead and sign off on my op report. And I am completed for that case. Very simple to use. Thanks for watching.